Hello, everyone. Welcome to the practical session on identifying research gap. This is brought to you by Dreams and Realities, and your speaker today is Amadi Fineface Chikadibia. Today, I'll be very fast and brief because this is a recap video, so I urge you to follow the pace. I will be defining research in a way for the purpose of this class. I would like to see research or define research as having two words, re and search. Re means again, and search means looking for something. So literally, research can be seen as search again. Whenever we are asked to search for something again, there are some implications to that. It could mean that the initial search did not solve the problem. The initial search was not conclusive, or maybe the initial search had some limitations. So let's go to research gap. What exactly is research gap? Many will say research gap is an unexplored area or understudied area. That's right. Some could call it a missing link. That's also nice. But in addition to that, whether it is an understudied area or unexplored area or a missing link, it must be relevant. That is the foundation upon which a research gap lies. So these two things we must not forget. In anything you want to call a research gap, an ideal research gap must have a gap that has been identified and the relevance of that gap. That gap should be able to advance knowledge. So the goal of finding a research gap is to demonstrate originality. Of course, the work should be original. It should be something that has not been done. Even though it is a topic that someone has done, but there's an approach you're taking on it, your objective, your methodological, your specifics, have to be something new from what has been done. That's where you demonstrate originality of your work. Then, of course, because it is original, it's going to bring something new that has not been done before. And because you're bringing something new, you are going to advance knowledge in the field. Now, the main part of this work, of this class, is identifying research gap. But before we go into the examples, class examples of what we are going to do in assessing, research gap, let me just mention some of the few research gaps. We have empirical, we have theoretical, we have methodological, we have population and setting location. You see all of this when I'm, dealing with the examples I have provided here. Now, before we proceed to the examples we are going to do, I need you to know that there are two pathways. There are two pathways of identifying research gaps. One is through the limitation channel or through the limitation route, and the other one is through tabular summaries. Now, the purpose of this class, we are going to focus on tabular summaries. But before we talk about tabular summaries in details, let me just give a little touch on limitations. One of the ways to identify gaps is through limitations. In primary studies, if a study has been published, if just one study has been published, the primary study, you pick it up, you read towards the conclusion, end of the work, you're going to see a subheading called limitation in a well-written article. Say every article should have limitation, because there's no article that is flawless or that actually solved all the problem in that field. So there must be limitations. Those things the author couldn't do. Those things that he wished he could do to advance knowledge in that field, but he couldn't do. So it could even be as little as sample size. It could even be as little as sample size, just as I mentioned. So you can find limitations there. Those limitations you find are already gaps that you can explore because he couldn't do them. He saw them as things he couldn't achieve. But then, as beautiful as it is and as simple as it is to find, it's not the most suitable or reliable because it is just a report from one study. A report from one study. What looks more reliable is getting the limitation from a systematic review. When you pick a systematic review, you go down the page towards conclusion. A well-written systematic review, again, should have a limitation. And because systematic review is a collection of studies, not just one study, unlike the first one I mentioned, systematic review can collect up to 5, 10, 15, 20, and so on, studies. So imagine limitations coming out from that. It's not going to be a limitation of one study. It's like putting all the studies together and, identifying the limitations of all of them. So this tabular summary is still a component in systematic review. So I just brought that out to give you a clearer picture because this is something you would be doing on your own. I need you to know that the bedrock of every research gap identification is literature review. You are going to do literature review and understanding of the science in your field. Understanding of the science in your field, because when you understand the science in your field, you'll be able to know the relevance of why this gap is existing and why that is existing. So this is one example. Now I have done my literature review. I've gathered studies. I gathered like 9 studies, and I put them all in a table. The beauty of this kind of research gap identification is that I can see all the studies at a glance. I can easily compare them. It's not like a normal literature review you write, the essay one you do, we do write, where you have to read from page to page. Before you get to page 3 or page 4, you have even forgotten what page 1 is talking about. So it's not so easy for you to easily relate. But from here, you can see everything at a glance and you can easily compare. So what I'm going to do with what I have here, I have seen what every study did, at least the summary of what they did. If I need clarification, I'll go back to the individual studies to get some in-depth information. But this is a summary of what they have all done. So I'm looking at that. I look at study design. So looking at study design. All of them, except one, worked on cross-sectional study. So what is new? What can I bring in? Is there a design that I can take up that can change this narrative or that can improve our understanding? Remember, this study we have here is looking at adherence rate of antiretroviral therapy among pregnant women in Nigeria. So we are looking at how pregnant women adhere or complied with their treatment. What was their level of compliance to their medications? This is what we want to know among pregnant women in Nigeria. So most of the studies in Nigeria conducted were cross-sectional studies. That means they were giving us the adherence rate of that time and space. That's what cross-sectional studies is about. It gives you the immediate information at the time you entered that field. So it's not giving you a backward information of what it has been. It's not giving you a historic information of what it has been. It's retrospective that does that. Now, fine, we have retrospective, we have cross-sectional, but I believe that if I include prospective study or a longitudinal study, it's going to give me another line of information that will actually advance this field, that will be relevant. How do I mean? Now, if I do a longitudinal study, I'll be able to see the compliance of these people living with HIV, these pregnant women living with HIV, how they complied, how they adhered to the treatment over a long time. Because this cross-sectional is limited. It's just telling me about it now. Maybe they just got a sort of education or there was sort of awareness or campaign and all of that at the time when I went to conduct this test. So they all adhered, So, but we don't know how their adherence behavior has been sustained over a long time. And that is what is more important, because any intervention is intended to, achieve sustainability. So a longitudinal study should be able to answer that question for us. But it's lacking here. So it's relevant, it's a gap, and this gap is relevant if filled. Another part I want to talk about is adherence rate. Now, this is a parameter that is being measured. So this is an empirical data. So looking at all of this, it's just one thing that was measured, adherence rate. And we want to add more parameters that will give us more insight, advance our knowledge in the field. It's not just enough to say the adherence rate is this, adherence rate is that. It's good, but then I think more can be done. If I include gathering data on the factors that affect adherence rates, I think it will advance the knowledge a bit. For example, we want to know if the stage of pregnancy determines how these patients or these people living with HIV adhere to their drugs. We want to know if the number of childbirth, maybe those that have given birth 2 or 3 times, and living with HIV, if the number of childbirth, determines the adherence rate. Some persons get a bit complacent after they give birth to 2 or 3. I beg, they get used to the antenatal care, they get used to everything, and compliance may not be the same as what it was at the beginning. So it could be a factor that's affecting. Education, maybe those who are more educated are compliant than those who are not uneducated. Or what else? There are just many factors that we can look at. But none of these studies have mentioned it. So it is a gap. Because if we know, why is it relevant? If we know this factor, we'll know how to have a targeted intervention. We'll know how to focus our intervention. Maybe if we notice that those who are more educated are adhering, then it simply means that the intervention should be based on education. There should be increased education so that adherence rate will increase. So you see that is lacking. So it is a gap that we can fill. Then look at the age group. These studies captured people within the age of 27 to 37. The least is 27, the highest is 37. This is a serious problem. For me, this is a serious gap. Because pregnancy does not just occur from age 27. What happens to teenagers? We have been crying of teenage pregnancy. Young people are getting pregnant because they are not sexually active. And they're also coming down with HIV. Okay, because most of them, because they are naive, they don't even use protection. Contraceptive, they don't use. So some of them get infected. But yet, these studies did not include them. So this population was completely cut off. So there's need to capture this population, to bring them in. It's a serious gap, and it is certainly relevant. And they even excluded those who are beginning to age when it comes to pregnancy. They didn't exclude, they didn't capture them from 27 from 37 years upwards. Were not captured. Have they stopped giving birth? Don't you think at that point there could be some behavioral changes that may influence? So they were not captured. So there is only a woman has roughly 30 years of childbearing, and out of this wide range of 30 years, you only captured these studies only captured a space of 10 years. What happens to the large 20 years? Thrown away. So that's a serious gap. Another thing we can look at here is we've looked at age. Now is yeah. Let's look at here. Most of these studies are old, and this looks more like an epidemiological study. And anything that has to do with frequency and distribution of disease requires regular updates because there are lots of policies from the government, organizations, support systems, programs, and all of that from NGOs and so on that can change the trend. That can change the trend of this. Or just imagine Trump, United States have stopped what's it called? Funding some of these agencies, these organizations. And I believe the HIV program is affected. So is that not going to change? Wouldn't that change the trend? So you see that there is need to have regular update on the real trend, real epidemiology, frequency and distribution of disease. So some of this information we have here, I think are already getting obsolete. Then let me talk about geopolitical zone. It's going to address issue of location. Now you see that most of the studies are in southern regions. Only one was in the north. Only one was in the north. And that's not central. Abuja, the FCT. We have south, southeast, southwest, and so on. So the north that is even mainly involved when we talk about teenage pregnancy, it occurs more in the north because children are given to marriage in the north. And where this is being practiced, we cut them off. They were not included in the research. Research was done even more in the south. So it's logical that it's done in the south because HIV is more prevalent in the south, or based on recent reports. But then this thing changed because there was a time it was even high in Taraba. Taraba was the second at the time in Nigeria. But then due to the fact that people are given to marriage early, we cannot exclude the north. So there's a gap. Let me take the next example. Wow. Take the next example. Example 2. This is the first example will benefit those in public health, community medicine, what have you, even in microbiology, including nurses, But this now will help those in biomedical science because you're talking about treatment and the efficacy of the treatment. So in this study, we are looking at the use of bitter lemon in treating diabetics in human beings. So what are the various gaps I can see here? One, I can see looking at treatment type. Looking at this type of treatment, we have bitter lemon aqueous extract, we have bitter lemon tablets, we have bitter lemon. Now, bitter lemon alcoholic extract is not included among studies identified. This is a gap. Why did I say it's a gap? Remember I told you it is not enough to identify a gap, but you must provide a reasonable cause to why it should be included. It must find relevance in advancing the field. Why I'm bringing it in is because not every phytochemicals in plant extracts that are extractable in water solvent. Most of them are even extractable in alcoholic, solvent. So using water solvent it's not has still created a gap because some vital ingredients are missing. So I want to take a study that also does on alcoholic extract. Not just ending there. I would also want to compare. I can find another gap again to compare between alcoholic extract and water extract or aqueous extract of bitter lemon to know which of these extracts provides the best treatment outcome. Then look at the next classification. Now, this treatment all of them focused on type 2 diabetes. And we have various forms of diabetes. We have type 1, we have gestational diabetes. But this study didn't look at them. This is a population that is before us. We see them every day. They are there in the hospitals. But they were not captured when diabetes was being considered to be treated with bitter lemon. Why? We think this is not a good one. There should be inclusivity. Let me talk about the empirical data. FPG means fasting plasma glucose. Then, of course, anybody suffering from diabetes, one thing they always want to check on you is your glucose level. That's what that is. Then that HbA1c is glycated hemoglobin. It measures how long your body has been able to manage glucose for the past 2 to 3 months. We have 2-HPP. 2-HPP there measures it's called 2 hours postprandial. It tells you how your body manages glucose for the past 2 hours after you have eaten. Okay, so looking at all of these parameters, well, they are all good, but I think if more parameters are added, they will provide deeper insight on how bitter lemon is used to treat, on how bitter lemon effectively treats diabetes. Very good. I've even identified another gap based on the treatment type. I'm still coming back to this empirical. Based on the treatment type, since these studies are saying bitter lemon treats diabetes, is able to knock down glucose level, I can also want to compare bitter lemon and conventional drugs, that's pharmaceutical drugs, to compare their efficacy level. Which one is more effective? Are the effectiveness comparable? These are gaps that you can touch and advance knowledge in the treatment of diabetes. Now, coming back to the empirical. So I can look at more parameters that will give me more understanding, insight on how bitter lemon is effectively knocking down. Based on this study, what this study has only told me is that, look, bitter lemon reduces glucose level or glycemic index. Let me use that word. Glycemic index embraces all of them. It reduces glycemic index. But there is a theoretical gap. How does it do that? So there are some parameters I may include here that will help provide that question of how. Try to explain the theory, the mechanism of how it does that. If I do HOMA-IR, it will let me know that, look, it improves insulin resistance. If I measure insulin level, it will help me to understand that, look, it's able to bring down glucose level because of increase in insulin production. That's if the insulin increases. So it's giving me some sort of rationale or explanation to how it's able to knock down glycemic index or glucose level. So I can even go further to even do inflammatory markers and oxidative stress markers, because this inflammation can cause diabetes, and when diabetes is already existing, can also complicate the case. So if these drugs, if this bitter lemon, which has already been established to be antioxidative and anti-inflammatory, is treated, does it reduce these markers? And if it does, that can be a mechanism to how glucose is taken off. So you can see that a lot of things can be done. From this study, I have noticed methodological gap, I have noticed population gap, I have noticed theoretical gap, I have noticed empirical gap. So moving forward, I'm done with the 2 examples. So I'm going to expose you to your own practical activity. Activity 1, you have 2 activities, activity 1 and activity 2. So you're going to do these 2. Now let me explain just a little before you take off from there. You are the position 7, although not numbered, but you can see the U. So assuming you are going to be the 7th study, what will be the gap? What will you do different from what others have done, these other studies have done, and why? The same thing will apply here. Now, I have provided on the platform the Google form link where you answer this question. Answer them, I will receive it from my end and assess it. So, thank you for listening. If you also have a question, the Google form has a space for you to ask questions, and I'll try my best to attend to your questions. Thank you.